Hello and welcome to the Health for Mzansi podcast, where we bring you inspiring stories from the front lines of medicine. I'm your host, Dawn Numdu. Today we explore the fascinating world of acupuncture with Rebaone Monama, a distinguished practitioner at the African Center of Chinese Medicine and Acupuncture. Rebaone is known for bridging traditional techniques in modern scientific understanding, bringing a unique perspective to holistic healing in Africa. In this episode, he shares his journey from his early inspirations to how his dedication to acupuncture has influenced his work in integrating traditional Chinese medicine with contemporary healthcare practices. Rebaone, thank you so much for joining me on the Health for Mzansi podcast. So when I came across your work and what you do, I was like, I have to get this guy on the podcast. I have to find out more about what he does within the healthcare sector. Welcome to it. Thank you so much for joining me.
Thank you for having me.
Now, I like to start with a bit of background of my guest. Where did you grow up? A bit about your family. If you can just share a little bit about that with us as a start. Thanks.
I grew up in the Northwest, in a small town called Klerksdorp. So I grew up with a mother without a father. Unfortunately, I did not know my father growing up. And then I am the last of three. We were four, but the last one passed away in 2020, unfortunately.
I visited the Northwest once or twice for work. What was growing up like for you? Were you a very ambitious child or very shy and quiet type of person? Maybe you can share a bit about that.
Funny enough, I grew up as a shy and quiet child. As I was observing all my siblings doing whatever they were doing, going to school, I was the quiet one. But as I grew up, I started talking because the family that I am from, it's a loud family. So I adapted into the situation of being a loud person and a speakful person.
I do pick that up. You're more quiet, very calm, and I guess it also has a lot to do with the work that you do because you graduated with a distinction in complementary medicine from the University of Johannesburg, and you're currently pursuing a master's degree in homeopathy. Can you share a little bit more about what motivated you to specialize in this field and a little bit more about your experience during your studies?
The primary reason that I started pursuing complementary medicine, it was the advantage and the effectiveness of complementary medicine. Of course, this includes acupuncture and homeopathy. So how I was introduced to it is that my older sister, she was suffering from migraines. She suffered from migraines for approximately 12 years, but she was seeking help from the conventional medicine as this was the only medicine that we knew because we were not that well educated about the types of medicine around. So she only used that. So her migraines would go away and they'd come back in 2 days. So it was not helping. So a friend of her told her about a homeopath, which she was also an acupuncturist. And then she treated her using acupuncture and homeopathy. And then it relieved her as she has migraines once in 4 months now. So after witnessing the positivity of homeopathy and acupuncture, I grew an interest in this. And then I Googled which university offers this acupuncture and homeopathy. And then I found out that the University of Johannesburg was the only university that offers acupuncture and homeopathy. So I enrolled. But while I was studying, at a point in my life, I faced significant challenges. So these challenges led to me thinking of quitting the actual program as the academic stress was overwhelming for me, like maintaining academic life and social life. It was just too much for me. So I thought of quitting. Fortunately, I'm thankful that I had the privilege to share my struggles with Dr. Zicheng, who was a respected expertise and the president of the Chinese Medicine and Acupuncture Association of Africa. So I observed him while I was a student, and he's been a source of my inspiration as you need inspiration to go through something. He was a source of my inspiration and passion for acupuncture. And I always had this impression of him because it's how he carries himself, how he speaks himself. So I saw the doctor in him. So what he gave me through those years, it's something that's invaluable insight. So I shared to him, I told him what was happening. I was struggling financially, I was struggling academically. He listened to me, he took the time to listen to me, show appreciative of, and then he offered a fresh perspective on the situation. And then he encouraged me that everyone goes through a struggle, that I should persevere through it, because if I quit, there's nothing that I'm going to get from all the tears that I've cried over the years that I have enjoyed in the University of Johannesburg. So I listened to him as I respected him. He helped me through the difficulty of learning. He helped me coming up with the strategy to study. He helped me the strategy to manage stress. Then I am grateful for this. So that's my experience on my studies.
It's just a real struggle to push past the balancing of academics and, just life in general as a young person. So I definitely think that you've managed to kind of move past that beautifully. And I'd love to know and understand more of that as we continue our conversation today. Specifically just your passion and some of your responsibilities in the work that you're doing, because you're currently, the National Secretary of the Chinese Medicine and Acupuncture Association of Africa. Maybe you can talk us through that and also more of what you do as a representative for this association and more about the work in Chinese medicine and acupuncture. How do you contribute to the advancement of acupuncture and Chinese medicine in Africa?
As the National Secretary of the CMAAA, my key responsibilities are to coordinate various activities in the field of the Chinese medicine and acupuncture. So normally we would go once a month or twice a month when we have time to go into some community engagement. So I help in doing those things because we have to do public awareness, because a lot of people are not aware of acupuncture. A lot of people do not know what is acupuncture. So additional to that, my role also includes improving the capacity of training more local students in the acupuncture and the Chinese medicine to improve the wellness. So as you know, the Chinese medicine are categorized as a scarce skill, so due to the limitation of the service that are provided in the country. So in our association, we also provide consultation and advices for the stakeholders, because we do have members of the association. In 2022, I facilitated Dr. Hu, the president of Chinese Medicine and Acupuncture, as I've already said before. He was doing a review on the benchmark for the traditional Chinese medicine of the Hu documents. And then I also facilitated him on consolidating the registration of the dispensary and compounding license for the traditional Chinese medicine and the National Department of Health. Through these responsibilities, I can contribute to the advancement of the Chinese medicine and acupuncture, playing a proactive role in integrating this practice.
Now, your practice at the African Center of Chinese Medicine and Acupuncture in Sandton, can you describe a little bit more about what a typical day at your clinic is like, and also the range of health concerns you address with your patients? And for those that might not know exactly what it is that you do, so what is acupuncture, if we can just go back to the drawing board for those that might not even be aware?
Let me start by explaining what is acupuncture. Acupuncture, it uses thin needles. These needles are sterile. There are specific points in the body that we use these needles to stimulate the body to heal itself. So this is completely different compared to dry needling. As dry needling just punches where the pain is, but with acupuncture, they uses the traditional Chinese medicine theories to drive them where to put their needles. So in January 2024, I was successfully registered with the Allied Health Profession Council of South Africa as an acupuncturist. This allows me to practice acupuncture in South Africa. So in my practice in Sandton, my day begins with setting up the clinic and reviewing up the schedule. I start by conducting through consultations with patients, assessing their health concerns through the diagnostics method and modern tools. So in Chinese medicine, we have what we call tongue diagnosis and also pulse diagnosis. So from the tongue, we can tell the body's circulation. We can tell what's happening with the body's circulation. And then from this, we can tell you on what to change in your lifestyle, in your diet. For instance, let me use this example. By the way, this example was given to me by Dr. Wu Zijing. I heard him use it in his practice to explain to patients. So what he said is that like plants, we are different. Think of a plant. There are plants that are indoor plants, and then there are plants that are outdoor plants. With people, we are also the same. Just that with acupuncture, we learn from nature. So everything that nature does, we learn from it. So other people are suitable for certain conditions, and other people, some conditions are pathogenic to them. So areas like that, from the tongue and the facial complexion and the pulse, we can tell them. And then the conditions that I come across in my practice include the chronic pain, digestive issues, stress management, The biggest one is stroke rehabilitation, as stroke places a huge burden on people. Imagine one day you wake up and you cannot do the basic things that you used to do, and then you have to rely on other people to help you do this thing. It's physically and emotionally straining. The therapies that I do there, it includes cupping, moxibustion, and also treatment.
Absolutely amazing. That element that you spoke about, patients that have gone through strokes, that have to kind of be rehabilitated, that is a very frustrating process. I know from family members that I've seen go through it and friends. We all know someone that has been through it. So really grateful and hats off to you for helping those patients and all patients who struggle with pain and other, issues as well in their life. Now, your research, as I understand it, focused specifically on the clinical effects of D. vicosa. Maybe if you can just give us a little bit of an explain on what that is and kind of what led you to this particular plant and what you've been doing and what have been some of the significant findings from your research so far.
The herb that I'm interested in researching, as I am a master's student at the University of Johannesburg right now, it's Dondonai viscosa. So in short, we call it D. viscosa. The reason I decided to research this herb, it's not because of this actual herb. It's not just because of one herb. It is because of through studying acupuncture and seeing how acupuncture has been globally successful. So I grew a passion of wanting to use traditional Chinese medicine to also modernize African medicine. So this herb that I am researching at the moment is an African herb. So I've noticed that Africa is a rich source of medicinal plants, and that these plants have been used by our ancestors in the past. However, the knowledge is not passed down to us through what happened to South Africa. So as I have explained that I want to use traditional Chinese medicine as a road model to also study our African herbs, I've developed an interest in contextualizing the research in our continent. So advancing the African plants in my research, I have focused on evaluating its clinical effects and bridge the gap between traditional knowledge and modern science. Because traditional knowledge and modern science, for us, it's different, because for how they were practicing the herbs back in the days, it has something to do with ancestors and everything. I look into more of the modern science. While I was researching, I found that it has anti-inflammatory effects. Anti-inflammatory effects which will help more patients in terms of pain instead of taking painkillers. As we all know, painkillers have side effects. In the long run, it can give you gastric ulcers. You may have other complications. With this one, it's safe. It does not have any side effect. I've also researched that it has antimicrobial effects, and then the safety profile is safe, as I have said.
I think the advancement of traditional herbs and practices is what I really want to pick up on, and I really want to commend you for that aspect and focusing on this specifically in collaboration with the work that you've done through the knowledge of Chinese medicine. I think that's brilliant, and hats off to you for that. You've coordinated international collaborations in acupuncture. Can you discuss, some of these collaborations and how they've influenced your practice and understanding of acupuncture over the years?
So as the CMEEE, we have had the privilege to collaborate with international institutions. For example, we have hosted 4 international webinars in the past 4 years. This includes the Fuji University of Traditional Chinese Medicine, and then the China Zhejiang Chinese Medical University. Coordinating this international collaboration in acupuncture has significantly enriched my practice and understanding of the field. This has encouraged me to see the future of acupuncture. Remember, as it is a limited number of practitioners that are practicing acupuncture, so to some degree, you do not see the future of acupuncture by collaborating with other people. This enriches your mind. It gives you a different perspective on how acupuncture can be applied, and then how acupuncture can be applied in different people who are living across the planet. So this helped me in terms of how I can better create a treatment plan for my patients so that they can have a better quality of life.
Now, you have over 5,000 hours of practice in acupuncture clinics. How do you approach patient care, particularly in creating a comprehensive treatment plan that addresses both physical and the emotional well-being of your patients?
I started shadowing Dr. Who's private practice on weekends while I was in my second year of the university. With over 5,000 hours of practice in the acupuncture clinic, my approach to patient care is mostly centered on creating holistic and individualized treatment plans that addresses both physical and emotional well-being, particularly in a typical treatment plan that starts with identifying the body constitution. As I've stated before, all of us have different body constitution. Firstly, some people tend to suffer from more coldness. Some people tend to suffer from heat. So I use that to adjust their treatment plan using diet, exercise, lifestyle. As if some diet tends to be more cold. For instance, green stuff in acupuncture, we classify them as cold food. And then food like meat and stuff, we classify them as the warm food. So as a patient, when I see you and determine the body constitution that you have, I will give you the lifestyle, the type of exercises you should do, and then the type of food you should eat according to your body constitution. These things that I just spoke of, like the body constitution, they are achieved through an assessment using the Chinese Medicine diagnostic techniques that I have told you about, such as inspection of facial complexion, the time diagnosis, the pulse diagnosis.
Thanks so much for sharing that context. I think there's so much more that I can probably ask you about this practice. I'm sure the words that you're sharing is simple, but there's so much more that goes into it. And we can speak for days on what you do and your work with patients. And I'm really appreciative of you just sharing a little bit of that knowledge with us. Now, looking back and just going over some of the work that you've done, you've had some time as a wellness consultant at Wellness Warehouse and as a tutor in complementary medicine. What valuable lessons did you learn that you applied to your current practice today?
In 2022, I was a tutor and also a wellness consultant. My primary goal as a wellness consultant was to assist people by recommending supplements and lifestyle changes to help them reach their optimal health. Doing this taught me how to be humble, sympathetic, and how to be an attentive listener. As being an attentive listener, it's something that is vital as a practitioner because you need to listen to your patient. Well, I was a consultant whereby there was a mid-50-year-old female who came in complaining of menopause. She was very irritable. So she was directed to me as I was the only consultant at that time on the floor. The way the lady was irritable, I feel like she was not irritable at me, but at what she was experiencing. The symptoms that she was experiencing were making me irritable. There was a point whereby while we were talking, she was like, "Do you know what you're doing? Are you sure of what you're doing?" But she said it in a rude way. So like meeting these people from day-to-day basis there as me as a consultant showed me on how to make educational decisions, on how to look far better than emotions. Because, for instance, as people, we are driven by emotions. But as a doctor, you have to understand that this person is not acting in this way because she is that kind of a person. But you have to understand that this person, they are in pain. I have to make an educational decision on how to help them get out of that pain. Even though when sometimes some customers there, when I was wellness consultant, they were rude and everything. So it helped me in terms of how to have effective communication, how to build trust between me and the people that I was assisting. It taught me on how to respect cultural sensitivity because you meet different kinds of people. There are Muslim people, Christian people. But when you give them something, you have to be sensitive to their culture. So Muslim people, they have to eat something that is halal. Some things that you give them, they do not have to contain some certain substance. So you have to be sensitive to their culture.
This is true. The cultural sensitivity, kind of looking at this person from the medical and health perspective instead of just what they're saying and doing in front of you is key, I think. Thank you so much for sharing more of your experience with that. How do you see acupuncture integrating with conventional medicine in the South African healthcare system? And what do you believe are the most significant benefits it offers to patients?
I firmly believe that this is not a dream, that acupuncture can be integrated with conventional medicine. There's evidence found in many countries such as China, South Korea, Singapore. Traditional Chinese medicine is effectively integrated into conventional medicine. They are working together, these people. So we can use these people as a role model. And as South Africa, we can also integrate the traditional Chinese medicine into conventional medicine. The benefits that I believe that this is going to come up with, if we do it, is that it's going to promote the quality of life of our patients. So South Africans will have a better life. Drawing into information from the research, I've read somewhere that it says approximately 80% of the young females miss school due to period pains. Acupuncture and conventional medicine they can approach this matter in an effective way instead of just giving them painkillers or giving them contraceptives to regulate their emotions. And then the WHO, the World Health Organization, they said if we do this, acupuncture, it will save costs for everyone. And then it's also effective in reducing the side effect. So one example is that in a cancer patient, I've seen that chemotherapy, it's really aggressive, but it's necessary to some degree. So with acupuncture and conventional medicine, they can give chemotherapy and we can deal with the side effects of chemotherapy.
Thanks so much for sharing that and your take on, the crossover between acupuncture and conventional medicine. My last two questions for you. One is just, if you could share an experience where your work has really significantly impacted a patient's life or contributed to community health, particularly through your practice in acupuncture.
So I think that can happen through health education, diet and lifestyle changes. My patient that I have seen in community service and the patient that I have seen in my practice are able to have a better quality of life because they are well educated. They know what to do. They know how to exercise. They know what to eat. They know how to dress. They know how to dress according to seasons. One example that I can do is that stroke patients, they cannot do anything by themselves. But after an acupuncture treatment, they see significant improvement. And this is life-changing for them. Because think about it, you cannot do things by yourself and then you get this help from someone else who didn't even know anything about them, then it helps you. So learning on how to help yourself get better, learning that there is acupuncture there, I think it does play a significant role in people. It uplifts the emotional burden and the physical burden onto patients. Patients get chronic pain relief from this. On a notable case involving a patient that was suffering from severe chronic pain due to a herniated disc, traditional pain management methods that includes painkillers were not helping him. And then I saw this patient, and then in a space of a month, he was pain relieved and the pain diminished. So it helped him to get through the daily chores, the daily activities. He was able to be himself again. So I feel like it makes us a better country by this because pain is something that disables you.
Our relationship with pain is so significant and we just learn to accept things, but then we don't know that there's light at the end of the tunnel. So thank you so much for that context and sharing more of your experience and work in it, especially around women and women's health. I think that was also a very important point that you shared there. Now, just looking ahead, what are your future goals in the field of complementary medicine and acupuncture? And how do you plan to further contribute to the advancement of this field, both locally and internationally?
So the first thing that I'm going to say is that improving public health and then raising public awareness, making sure that a lot of people do know there is help, there's light at the end of the tunnel, as you said. And then also integrating and advancing African medicine because we are sitting with herbs here. We are sitting with all the tools that we have to help ourselves, just that we do not know how to use them. So if we use acupuncture as a role model to know these herbs that we have and use them effectively, that will be a wonderful thing to do. And then one thing I was thinking of training more local students into the field, especially at a bachelor's level and also at a doctoral level. After doing my master's, I'm planning on doing my PhD in complementary medicine so that I can study various herbs and then I can publish a lot of articles on this so that it can be there. It can be written in hand that this can help with that because now we have a gap because nothing is written in hand. What we have, it's this can help with that. This can help with that from our parents, but there's nothing that is written. There's no modern science to support the evidence that this can help. So if I do that and the other local student that I have taught do the same thing in group, together we can conquer this.
As we wrap up today's episode, it's clear that Rebaone Monama's work is not just about healing the body, but also about integrating ancient wisdom with modern practices to create a more holistic approach to health. His dedication to advancing acupuncture and promoting its health benefits in Africa is truly inspiring. We hope that you've enjoyed this short but sweet taste in the world of acupuncture and gained a new appreciation for how traditional and modern medicine can work hand in hand. Until next time, greetings from me, Dawn Numdu, our technical producer Megan van der Vent, and the rest of the hashtag Team Health for Mzansi. Stay inspired.